Curly has always been active since I've met him. There are many, many days that I could not keep his schedule.
My legs just ached. I got referred to Dr. Gates, and she came back and said, "You've got some real circulation issues." Did the surgery. I walked a golf course yesterday. I haven't walked that course in years.
We live in such an amazing city. Good health care and good preventative health care are so important to us. I have nothing but praise for all of the care that I've received in Spokane since I moved here, and it's all been through MultiCare. And I'm a life that MultiCare saved, and I am very grateful for that.
Yeah, we had a couple of years ago a heart issue. Dr. Bregan Sanchez was the on-call doctor.
This was my second heart attack. I am an elementary school secretary in a kindergarten building, and we were doing a meet and greet for the families, and I was standing at the door to the school and just overcome by this strange feeling and started sweating, became very nauseated, and I called Curly and I said, "I think I'm in trouble."
Now when she says that, then I know something's wrong.
So we went to Valley. I already know what this is going to mean. It's going to mean that they're not going to let me go to work the next day, which was the first day of school. We're taking you to Deaconess.
I got a little bit. It was scary. I didn't want to lose my bride. We've been through some stuff together. So what she doesn't know is when she's going through this testing that it was hard. This is my bride, and I don't want anything to happen to her. You know, Dr. Bregan came out and says, "It's good, we're going to be okay here." But it was just knowing, okay, we're in good hands here. It's going to work out.
I feel fabulous because I take better care of myself.
What I have found through what we've been through together is the preventative side of healthcare that I really did not pay much attention to. She's paying a little more attention to
Being
the
active
side of it. I'm paying more attention to the eat healthy side of it.
And I appreciate you supporting and sort of pushing me to get out and get going.
And she puts this stuff down there now, and I will actually eat asparagus now, where before I wouldn't.
Women are just as predisposed as men to having heart disease. It just happens usually a little bit later in age. The leading cause of death amongst women is cardiovascular disease. Primary prevention is still the best medicine. We would rather prevent a heart attack than treat one. And those goals are there for men and women. I mean, cardiovascular care has become much more specialized. It requires advanced testing. Once it's diagnosed, it sometimes requires medications which are very costly. And some of our patients can't afford those medications. Some of our patients can't afford that testing. If we have additional resources to treat these patients, to diagnose these patients, then we will help improve the cardiovascular care of our patients out here in the Inland Northwest. With your donations, you're going to remove those barriers for the patients to be able to have their cardiovascular care and follow-up, and that's greatly appreciated.
There are people out there who are in need of care that maybe are at a time in their life they can't afford that.
The life they save might be mine, or somebody younger with kids. I think Spokane is filled with good-hearted people. You know, every little bit counts.
You know, they say give what you can, you always hear that. But don't give till it hurts, give till it feels good.